Hello, I'm Dr. Gil Wilshire at Missouri Fertility. Welcome to part 3 of our nutrition video series. Today we're going to be talking about the nutritional treatment of what I call garden variety polycystic ovarian syndrome. Before you watch this video, it's important that you watch both parts 1 and parts 2 of our nutritional series. Now, how do you know if you have garden variety polycystic ovarian syndrome? Well, women with this type of PCOS may have been misdiagnosed in the past. This can be a very mild form of PCOS and it can escape detection. Women with this type of PCO tend to be somewhat sturdy or bottom heavy as far as their body type goes. They may experience a little bit of menstrual irregularity, but not enough to really draw concern. They may have a little bit of hair growth or acne, but it's been manageable. Seems like it runs in the family, which it does, and it hasn't drawn much attention either. Another thing we see with this type of PCO is that a woman notices slow, annoying weight gain. She may eat the same meals as her husband. He seems to have a stable weight and do fine, but she seems to eat the same foods but persistently gains slow, annoying amount of weight over months or even years. Women with this type of PCO may have been athletic, particularly in high school. May have played softball or run track or something. May not be athletic now, but it certainly had benefits back when they were younger. Now, one of the most common labels that women with PCO are given is that they have insulin resistance. Insulin resistance is a big distraction. Let me explain. Insulin resistance is not a disease. Insulin resistance is a mathematical formula that essentially says insulin levels are high compared to blood sugar. It is a total distraction. The problem with women with PCOS is that their insulin levels are too high. Ignore the resistance, it's purely a distraction. Since insulin levels are high, the treatment is lower the insulin levels. Resistance will take care of itself. So, how do we lower insulin levels? The number one way to lower insulin levels is to reduce or eliminate dietary carbohydrates, as discussed in part 2. A second way to lower insulin levels is by increasing exercise a bit. Now, walking is obviously better than doing nothing, but if a woman can lift some weights and stretch, this will increase the muscle sensitivity to insulin, and it will lower blood sugars, which will improve the PCOS. Now, a common misperception is that exercise will help someone lose weight. It does not. If you exercise, you will get hungrier, but it will also help you sleep better. It will help your mood, make you feel stronger. There's lots of benefits to exercise. It will also lower insulin levels. So if one is exercising, make sure after a workout you don't eat the carbs, but you fill up on proteins. Very important. Now, if a woman is frustrated, she can't follow the diet, or her weight is yo-yoing, we can certainly add a medication called metformin. Frequently women will be given metformin before they see me, but we only use metformin if the weight loss or the weight is continuing to yo-yo. These are times when we might use metformin. In fact, we use it quite a lot. If a woman gets control of her PCO, her menses become normal, do not expect to become a rail-thin runway model. That's not the type of body that these women have, and that's not going to happen. Okay? Women with PCO tend to be strong, they tend to be sturdy, and they're very beautiful. Do not expect to become a runway model, and do not expect to get a normal BMI. Your BMI on the chart can still be in the slightly elevated range, but this is probably a normal, healthy body type and a normal body weight for this type of woman. Remember, women with PCOS tend to be very fertile once they get their metabolism under control. If PCO, especially garden variety PCO, caused infertility, these genes would have been eradicated from the gene pool thousands and thousands of years ago. This is clearly not the case. So, if you think you have garden variety PCO, cut out the carbs, increase your exercise, and generally good things will happen. If fertility does not come right away, then addition of other medications can be very effective. And in a healthier woman, these medications tend to work quicker and faster and at lower doses. So, there's my discussion of garden variety PCO and nutritional treatments of it. I hope you found this helpful. If you think you're more of a lean, athletic PCO woman, tend to be rather slender, love to run, or if you find yourself apple-shaped with real severe weight problems or diabetes type symptoms, stay tuned for our additional videos where we'll discuss those conditions in depth. I hope this has been helpful to you. This is Dr. Wilshire at Missouri Fertility. I hope you found this video helpful. Please like us on Facebook, subscribe to us on YouTube, and follow us on Instagram.